Hello and welcome to this week's episode of Jing TV. Got a really special episode for you this week because we have a very special guest, which is Meg's pregnant belly. So we're going to be talking about pregnancy massage. And a very special welcome to Meg's pregnant belly. Very exciting. Meg is pregnant. It's not just that she's been eating a lot of cake. So we thought that we would actually have this week's episode about pregnancy massage because you feel very strongly about it at the moment, don't you, Meg?
Well, it's amazing. So we've been teaching pregnancy massage, 10 years at Jing, but also we were doing pregnancy massage in New York where we used to work together. And always there was there are some key factors involved with pregnancy massage, right? One is side lying position, so how women are put on a table and how you can do that safely, which we should talk about. When women can get pregnancy massage. So years ago, we were taught women couldn't get massage in the first trimester, and certainly we don't teach that at Jing because it is incredibly safe to massage pregnant women if you know what you're doing in the first trimester. And so there was a lot in it, and we used to offer it at the spa, didn't we?
We did.
Both of us have been working with pregnant women. I mean, I started, I think, 20 years ago because the woman, when I was working at the clinic in San Francisco, they had one of those great massage tables. You know when they had they take out the bowl and you put your belly in it and the elastic would hold it. And as a 22-year-old, I thought that was great. As a 40-year-old pregnant woman, I'm like, that is crazy. How awful that would feel to lie on my stomach and be in these rubber bands.
Right. And I think the point is you don't need lots of specialised equipment to do pregnancy massage, do you? You just need a table or the floor even.
Yeah. And lots of pillows. Yeah, really lots of pillows.
Yeah.
So, those are really the things we want to talk about. So one is the first thing, that it's safe to massage pregnant women in the first trimester if you get the right training.
Yeah. And
most of that is about their positioning and also understanding what can happen in each trimester. Not that it's your job as a massage therapist to diagnose, but more to support what's happening. So, find a course out there that can really help you with understanding all the different conditions that help in, or the conditions that can happen in each stage of pregnancy. Do you want to talk a little bit about the side lying position?
Yeah, absolutely. And I think just going back to that thing around the first trimester, as far as we are aware, there is no research that supports there are any dangers to massaging women in the first trimester, but that contraindication came about because there is a higher risk of miscarriage in the first trimester.
Right.
So as far as we are aware, that was around insurers and teachers of massage being ultra cautious.
Right.
However, as times have evolved, most of the experts in pregnancy massage now teach that it's fine.
And I think it's important. I think everybody's human, and pregnant women are really human, and they are a little bit more vulnerable. And so if a miscarriage is going to occur, it normally happens in the first trimester. And so all of us, when something goes wrong, we want to look for somewhere to blame. And so if they've had a massage, then it might be the massage therapist who kind of gets put onto around the idea of blame or suing and that kind of thing. So that's why the first trimester is often out, as you said, exactly for insurance purposes.
Yeah. Sideline position.
Sideline
what I was supposed to talk about. If you haven't been specifically trained in pregnancy massage, which we would definitely recommend, there's also some great books out there. But the biggest thing, if you get a pregnant client, is to treat them in the sideline position pretty much all the way through. Would you say? I mean, you're the expert.
I have to say that usually we say second trimester that they go into sideline position. I'd say, actually, being pregnant, it's not as bad as I thought lying on my back. So it's much safer for somebody to be on their side. So if you want to err on the side of caution, do that. But if you want to work on somebody on their back, certainly not on their stomach, you just need to put a cushion underneath the right side to support
Okay.
the blood flow. So, and I'd say, maximum 20 minutes somebody being on their back is sort of okay if you want to do some head or feet work. But most of the time, side lying position is just the safest. It also gives a great angle to work on the neck and also into the QL and the piriformis, which is often an issue.
Yeah, and I think the biggest thing, because I did have pregnant clients when I hadn't had specific training in pregnancy massage, and I knew to massage them on the side, I read a bit of a book or something, but the biggest thing that I got in a flummox about was the draping.
Right.
And I think we're going to put some images up, aren't we, about the draping, but do you want to say a little bit about the sideline draping?
The big thing is called T-draping, so you get one long drape that goes under and along the body, and then another one that goes across the side. And effectively that means that the woman's chest can be covered while you then undrape the back and have it nice and exposed. Other stuff around pregnancy massage is that I have to say that I always knew it was important, but when I go to all these antenatal classes now, I cannot believe the list of pain conditions that all these young women are dealing with at all different ages, piriformis syndrome, migraines, low back pain, and fair enough, I have a pretty decent lifestyle, but at 40 I've had I'm 7 months in, so I've had no low back pain, I've had no sciatica, I've had a bit of leg cramps. But I really think that's about getting regular massage from the very beginning. Yeah. So it's a great business tool, I think, for people out there. Is if you haven't learned pregnancy massage, to do it.
Yeah, absolutely. And it's like if, a pregnant woman's never been for a massage in her life, believe me, she will be hammering at your door, right, in their second and third trimester.
And people buy gift certificates for people who are pregnant.
Yeah.
So there's loads to say about it. Maybe it'll come up in another episode. But I'll just say, and also touch pregnant women's bellies. They really like it. Don't be scared of it. So that is the end of this episode of Jing TV. If you want to find out more, you can come on to different episodes at iTunes. You can subscribe. Also, all the courses are at www.jingmassage.com. And you can follow us on Twitter, Rachel's favorite social media, or on Facebook, and get involved with the conversation. So put questions up there. We'll get involved. Other massage therapists are going to get involved. Don't be alone in your quest to help pregnant women and all of your clients.
Great. Thanks for watching.